and welcome to the September Exchange Essay Chat. My name is Brooke McIntosh, and I'm the Director of Communications for the Student Assembly. And this month, we are very lucky to have our very own President Sharon Dunn joining us tonight. Thank you so much, Madam President, for joining us. If you want to go ahead and introduce yourself and just tell the students a little bit about yourself, that would be great.
Thank you, Brooke, for inviting me to be here on the Student Exchange. This is a wonderful opportunity to talk to students. It's actually one of my favorite things to do. I'm a faculty member and program chair at LSU's physical therapy program in Shreveport, and I'm recently elected president of APTA, and I love the profession. I'm sold out. I drank the Kool-Aid a long time ago.
President, for joining us. If you want to go ahead and introduce, wait, oh, sorry. Hold on one second. Are you there? I'm sorry. It started talking over. Yeah, I'm sorry. The YouTube video was playing. I'm sorry.
No problem. No problem.
Well, we're so glad that you're here.
You know more about this technology than I do, so I'm glad you're.
I know, and look at me. I'm already messing it up over here. But we've got the kinks worked out. Now we're good to go. All right, so how about you tell the students a little bit about how you got involved in the APTA?
Actually, when I was a student, I volunteered to serve on the Continuing Education Committee for the Louisiana Physical Therapy Association. And they were just asking for volunteers, just show up and serve on a committee. So I served on that Continuing Ed committee, and I learned there that even a student can influence the direction of the association, because I was inviting the people that we were assigned reading from our course work, and the LPTA would bring them to Louisiana to our continuing ed courses. So I learned early that you have to get involved to influence the direction of the association in the future, and that was really the hook. That and the first state meeting that I went to, of course, in Louisiana, we do things a little differently. So we had a keg in the back of the room, and everybody had robust conversation and debate, and we got a lot accomplished in those meetings, but we had a lot of fun as well. So those were the things that got me hooked into the association. And then when I graduated, of course, Shreveport, Louisiana is my home, so I stayed in Louisiana and ran for secretary of the Louisiana Physical Therapy Association and got whipped. I got smashed in that first election that I ever ran for. Then I came back home and decided, well, I can serve locally. I was the Shreveport district chair, and then got involved in the politics of the association, advocacy. We were pursuing direct access for many, many years, and those were where I met some of my very best friends and closest colleagues through that advocacy work. And you work together with people who have the same passion as you, and those are lasting friendships and relationships. And when you accomplish something for the profession and those we serve, there's nothing like it. So those were the ways. That's how I got hooked. I think you're frozen, Brooke. There you go.
I thought you were a little frozen. We're back. So you were talking a little bit about how you got involved, and meeting some lifelong friends and things through the association. So who do you look up to professionally, personally? Who would you say is, that one go-to person that whenever, you get a little down or you need some backup, who do you go to? Who's your one go-to person?
It so depends. Being involved nationally, there's so many people who are go-tos in my professional network, so it depends on what the issue is. But I admire people who have grit and passion for getting things done and accomplished. So I have some mentors locally. My dean is Joe McCullough. He is probably an international expert on wound management. So I look to him for anything in life. But I also have people that I've served with through the association. Connie Hauser, who owns a practice in southeastern Kentucky, used to be the treasurer of APTA. Helene Farron is just one of the most reflective and thoughtful practitioners and advocates I know in the association, and then our current APTA board of directors, amazing people and colleagues. If you get to meet any of them, introduce yourself. They love working with students. Actually, the student assembly liaison is one of the most highly sought after positions on the board. Everybody wants to hang with the students. So any of the board members would love to meet you and visit with you.
Yes, and we love our liaison from the board of directors too. I know you've served as the student assembly liaison before too, and we were talking about that the other night. And you said, like you said, everyone wants it, so everyone wants to get in with the students. So we always try to tell students, you know, the professionals are always there for us. They're always looking to help as much as they can, and you just heard it firsthand from our president. So take, you know, just take the leap, go out and try to make those connections. So, Madam President, let's see. Whenever someone asks you what living the vision statement means, what is your elevator pitch to them?
Say that again. I missed the question.
Okay, I said, when someone asks you what living the vision statement means, what is your elevator pitch? If you've got 30 seconds, you're in the elevator with someone at a conference, what would you tell them?
We transform society through movement. We're the movement experts, and if we are living the vision, it means we're setting an example with exercise and healthy living. It also means that we care immensely about our patients' human experience. So we put a high value on a person's ability to move to enhance their quality of life. So when you're with your patients, your first question to them should be, what is this impairment doing to your life that decreases your ability to enjoy life? And usually it's something movement related, and they can tell you, well, I want to fish, or I want to dance at my daughter's wedding. Well, those are all movement impairments that we live for moments like that, when we can apply our science and our expertise to enhancing a patient's quality of life. That's what physical therapists do. So living the vision is all about the movement.
That's awesome. That's so, I mean, our vision statement which one, I love it. I just really feel like it's really given us some good ground to stand on. So that's awesome. I really love that. So for the students that are listening and watching, we're taking your questions on Twitter. Just use the hashtag the letter X change SA, and I'll take your questions live from there. But for now, we have some questions that are rolling in, so I'm going to go ahead and pull some from students live. So Kayla Keckinson asked, how do you
Okay.
professional network students in professional?
Okay. I'm looking at Twitter too, so I didn't hear you, but I can answer the question.
Okay.
Kayla, thank you for the question. And the question is, how do you recommend that the students form their professional network? Go to a national meeting. I think you have a great network right there locally within your class, and you develop such strong bonds and relationships within each cohort of students that you're connected to. But you only have a shared experience locally. The first state or national meeting you go to, you're connected with other people who share your passion, but they have different experiences and different knowledge bases that they can share with you. For instance, where a great clinical site might be, or where you can live if you go to that great clinical site. Or I have one of our graduates from our entry level program, who is a graduate of our residency, met a colleague at National Student Conclave a couple of years ago, and she did a clinical site where he took his first full-time practice experience in Phoenix, Arizona. And he's from Lafayette, Louisiana, had barely been out of Louisiana, but because of a connection he made nationally through going to the student conclave, he's now practicing in Phoenix, Arizona, and having a great time. So I would say, I know you're on a very limited budget, but go to at least one national meeting while you're enrolled in your academic program, because you'll meet so many people and then you'll form a network through social media, and the connections are endless.
I completely agree. So there's still time to sign up for national. The price doesn't go up until September 30th. And then even after that, you can register on site. So we hope to see you all in Omaha. I'm extremely excited. So let's go ahead and talk a little bit about that, because President Dunn will be joining us there as well. And she'll be conducting the town hall meeting. So President Dunn, do you want to tell us a little bit about how the town hall meeting?
The town hall is essentially an open forum. What I plan to do is share with the students some of the major priorities that APTA has going on right now related to the strategic plan and our new vision, but open it up for question and answer opportunities so any student there can ask me any question that they have. But I'm also interested in hearing feedback and suggestions from students, because this is your profession, and the things that we're doing right now will certainly impact our future, but they really have a strong impact on our students' future and what their careers will be like. So I'm not only going to visit with you, but I want to listen to you and gather input from what you would like your professional organization to be. So come loaded.
Who's willing to sit down on their Thursday night and answer our questions now? I can only imagine how awesome the town hall meeting's going to be. That's one chance for you to really get to talk to who's, working for you every single day. I mean, that's one of President's top priorities, is the students. So definitely show up to the town hall meeting. We're looking forward to it. So we're going to take another question from Twitter. Can you still hear me over there?
Yeah.
We're not cracking up too bad.
I'm hearing you. It's hit or miss, so I'm watching Twitter as you're going too.
Okay, so we're going with Ryan's tweet. Ryan Madry, who asked, what should a student be doing now to prepare for an active role at APTA Tweets Board of Directors? Which, listen, I'm all ears for it too. So not only students, but new professionals, old professionals, anyone who's looking to get involved.
Come to meetings. The way I started was locally within my state chapter. Most people don't want to serve forever on a long-term trajectory like that. So we have opportunities both in local and state chapters, but also on the national scale to serve on task forces, committees, and work groups. So watch APTA for opportunities to serve. Many times we'll put out a call for volunteers. For instance, we just had one go out to serve on a task force for best practices in clinical education. And there's a spot for a new professional on that task force, because we need to hear the new professional's opinion about their clinical education experience to inform the work of the group. So there are opportunities like that for you to watch, to participate. Also, make sure that you have your resume and your strengths loaded into APTA's VIP. That stands for the Volunteer Interest Pool. So if you already have your information loaded in the VIP and a call comes out, all you have to do is answer the specific questions about the call. But I would say form regional and local networks, stay engaged on Twitter and social media, and you will have information at your fingertips. We really want everyone to be engaged, because this is your professional organization, and we're listening. Half of communication is hearing what feedback is. So we want to hear from you and how you would like to participate, because everybody doesn't want to do it the same way.
That's awesome. Yeah, the VIP, so the pool, I don't feel like a lot of students or new grads really know about that. So that's an awesome resource. You can just go onto the APTA's website and just type it into the search bar and it'll come up. So go put your resume, go put all of your information in there, and who knows what kind of awesome opportunity might come your way. So I have a question for you. You have been the president for 3.5 months now. So what are you most looking forward to during your term as president? And what is the most exciting thing that's happened thus far?
Oh wow. Yeah, that's interesting. So many. I get exciting opportunities every day to make a difference. And with healthcare reform and payment reform going on right now, the environment is so fluid. But we're also getting new evidence that justifies putting physical therapy on the front end of episodes of care to save downstream costs. So it's an exciting time to be in leadership, and it's an exciting time to have such a strong board and so many areas for us to influence. So that excites me the most. What I'm most looking forward to is going out and meeting students and other professionals who share this kind of enthusiasm and passion about what we do, because that's where I get energy. That's where I receive energy to continue to do the things that I like to do as far as APTA work, advocacy, and then I come home so enthused and energized. My poor students hear APTA stories all the time, and they giggle at me because I go in and share with them things that are happening professionally, but they probably get more than they bargained for. But it is the question about how do you stay passionate and how do you invoke that kind of passion around you is just bringing people along, carrying them with you along for the ride, and it's bound to rub off.
So that kind of leads into my next question that was coming in from Twitter. I don't know if you saw that one from Michelle, but it was saying what suggestion or peers, especially when it comes to APTA membership.
Yeah, I think that's something that APTA is has been working on for a long time, because we have about a 30% market share of anybody that could be a member of APTA. We have about 30% of those people who are members of APTA. Some of them are very engaged at different levels, and some of them are members because they want the access to the information. So you find what that person values most about staying engaged in the profession. Is it about payment? Is it about private practice? Is it about becoming a better clinician? And then you plug them into those areas where they will see the most value for what their interests are. Most new professionals want to become the best clinician that they can be, and they have areas of interest. And one of the best ways to hook new professionals is through relationships that they make through the sections and honing their clinical practice skills and becoming expert clinicians. We found that the more sections that someone belongs to for the longer period of time, the more likely they are to stay engaged. So I say everybody's experience with APTA is different, and it's related to what they value in membership. And finding those areas that they choose to be engaged in is where you plug people in.
That's
It's hard.
awesome. Well,
It's hard when you're the one that drank the Kool-Aid and you're surrounded by people who aren't quite as enthusiastic. It's easy to get frustrated, but you just keep telling the story.
that's it. I completely agree. And if it goes back to how many sections you're involved in, I think that was really funny with me whenever I was interviewing for my first job. All of my sections are listed on my resume under my memberships. And he goes, so your membership is gonna cost me a lot of money because they cover our memberships at my job. I was like, but I have the new professional dues program. So I'm gonna save you some money in the long run too. So that's awesome. We have another question coming in from Twitter, if you see it over there, if you're not getting all of my words. John asked, how can we keep the profession moving in the right direction? A little vague, but I'll let you take it where you want it.
No, I think that's a great question, because of course, there are concerns about apathy, and there are concerns about physical therapy only being seen as a cost to the healthcare system. So I think we keep the profession moving in the right direction by bringing our absolute best to every patient we see every day. and looking to outcome measures and the tools that you're learning in your academic programs to use to measure your own clinical performance, even when those around you may not be doing it, but you will be able to benchmark your clinical practice and you'll be able to compare your outcomes to your peers and always want more. If you want more, you're bringing the best to your patients. Um, and we're all fairly competitive. Every time we have a student competition, it ramps up the stakes. So when you're able to compare your clinical performance to your peers, you'll have a little bit of incentive to be the absolute best. And I think our patients and society deserves our absolute best. So when we all bring our best to every patient, there's no doubt that we'll continue to move in the right direction. We'll show the public our value to their health and their mobility, and that's the way. Avoid hanging around mediocre, negative people unless you can bring them along. Find an area to practice where you're challenged and you can challenge those around you to be the best.
That's awesome. I have another question coming in. This is from a new professional. Her name's Natalie Wilson, and she asked, what do you hope to accomplish / change as president, and how can we help?
Hi, Natalie. What do I hope to accomplish? I hope that everybody knows where APTA is going. And you guys are excellent at using social media and communications tools and your networks to spread the word. So if anything could be accomplished, it's to share with our internal and external communities where we are, the good things that APTA is doing, because we could do so much more if we had a greater market share of members. And we do a lot with what we have, and your board of directors is very serious about being good stewards of our resources. But if we had double the members, oh my goodness, what we could do for our communities and society. So spread the word, as you are so good at doing.
I think that last part. Well, we're not connecting well. We're just gonna keep going with our questions.
But so I'm hearing you
occasionally. That's okay. So next question. So you and I were talking about this a little bit last night, about how the cost of tuition has skyrocketed, but our reimbursement isn't allowing for our pay to reflect the cost of tuition. What are your thoughts on that?
This concerns me a lot. This is one of those things that keeps me up at night, because I know what a valuable education is, but I also know that payment in physical therapy is not keeping pace with the tuition rates that are being put upon students. And it's frustrating for students, and it's scary for me as a program chair, because I'm afraid we're going to outprice our market, and we're going to lose some of the best and brightest to other professions. So what we can do, I think what the Student Assembly could do, and this is one of the questions you had for me, Brooke, was what could the Student Assembly do better? CAPTA, our accrediting agency, posts data every year on tuition rates. Every school in the country has to share with CAPTA what their annual tuition is. So that data should be published so that students interested in applying to PT school have that information as they select their programs. And it's a supply and demand issue. It's another thing that the Student Assembly could work with APTA, and that's the organization that represents academic programs, to see how academic costs could be lowered while we work on the payment. APTA certainly is working on the payment aspect of it in advocacy and looking to make sure physical therapy is positioned appropriately in the reformed payment methodology. But I really am concerned about this. I think higher education is the next big bubble to burst. And in the United States. And unless we do something, it's not going to be affordable for people to go and get higher education, not just for physical therapy, but other professions. But one interesting program that just started at South College in Tennessee. It's a distance program. John Childs and some of his colleagues are innovators in this. They're decreasing the number of years in a physical therapy program and increasing the amount of time in a full-term clinical internship that moves towards residency. So there will be less tuition and more clinical time in that. And that program just started this year, and a lot of people are watching to see what the outcomes are going to be of that program. I love innovation. I think the more we talk about this with students and faculty and the profession, certainly we'll be able to find some solutions. But I think the best thing the Student Assembly can do is find all of the information and data and be very transparent with it for students that are applying to PT schools.
Yep. I mean, that's awesome. I know, I mean, PT school's competitive too. And I know, a lot of students apply to a lot of schools, and, they really want to be in this profession so bad. A lot of students end up getting into the more expensive school, and having to go through that. So I don't know, hopefully, our reimbursement, we can keep working at it, and we can, get paid what we deserve for the care that we give. So.
I agree. And don't settle for a low salary. But
also we were talking about don't settle for treating 40 patients a day either.
Right, because somebody, if physical therapy clinics are such a commodity right now, you've heard of all the consolidation going on in physical therapy clinic purchases. Somebody is consolidating because they see a revenue potential and opportunity in what you are becoming licensed to become. So there is still a decent revenue that's able to be generated through physical therapy. So know your cost, but also know your value when you go in to interview with different places. And the simple questions to ask are, what are the charges? How many patients would I be expected to see here? What's your average revenue per patient? And what are the costs to run this clinic so that I can come in and make sure I'm pulling my weight, but I also want to be able to intelligently negotiate for a fair pay for what I'm doing. I love the way dentists are doing their practices right now. You see most dental offices have partners and junior partners. So having a high expectation for what your practice is going to be, but also being open to the risk of maybe not making as much your first couple of years until you've built up reputation and some expertise within that area and becoming more efficient. So I think investing in some loyalty, staying in a group to show your sweat equity, and then demonstrating your value to a practice, but also having the expectation that you show that sweat equity and you have some ownership.
That's awesome. So #FreshPT, we all need to be asking the hard questions before we accept these jobs. So you heard it here first. Knowledge bombs are being dropped everywhere tonight.
That's a hard thing. Those hard questions are difficult because you don't want to be perceived as arrogant, but you can be confident and you can ask hard questions, and you should expect the questions to get answered. Now that person might not want to hire you because you're intelligent enough to ask the hard questions, but that's okay. You'll find somebody who values that kind of intellect, and they want to be challenged as much as they will challenge you.
Yep, that's awesome. So we got another question coming in from Twitter. If you want to look at your phone in case you can't hear me, it's from Luke Davidson. And he asked, how can we as students help to motivate current PTs to present a more unified profession during clinicals?
Oh, wow. Yeah, that's a tough one because it depends on where you are doing your clinical internship as to what the level of practice is within that. I like to tell our students as they go out on the clinical internships to be the mirror, not necessarily the reflection in the mirror. So to do the things that they've learned to do, not be critical because they have something to learn no matter where they go, and ask questions. If something is being done that's unfamiliar to them, ask why, because a lot of times there's a legitimate reason and you're not familiar with it, so you'll get the answer. But always expect the best from yourself and be the example, because a rising tide lifts all boats. And as you go out and practice your absolute best, those around you will get better as well. You don't have to go in there and beat your chest and brag, because that's not cool. But you can go in there and be the example of bringing your best every day.
Yep, that's awesome. We're getting all kind of questions in from Twitter, so we're just going to keep them rolling. So
Good, I love it.
Everyone's. So next, we're going to go with Matt Stoltman's question. He asked, "How do you envision physical therapy as a profession making headway in demonstrating value to payers and healthcare?"
Okay. I don't see that on mine. So will you repeat it one more time?
I will. So he didn't tag you in it. It's under #exchange essay. It's,
okay.
How do you envision physical therapy as a profession making headway in demonstrating value to payers and healthcare?
Data. We have to have data. We used to could go in and tell people how great we were and expect them to believe it, but that's no longer the case. And so the outcomes tools that you're learning to use in your academic program, the federal government mandated it a couple of summers ago by instituting G codes, the functional outcome measures, functional limitation reporting. But you will have to use your outcomes data to show a payer how many visits it takes you to get perhaps a rotator cuff repair back to work if they do manual labor, or how many visits does it take you to get someone with a neck dysfunction back using the neck disability index. What is your level of performance? And it's not going to be all based on performance. That'll be one piece of it. Of course, and I was talking to my students yesterday about this, and they said, well, Dr. Dunn, what about those populations that we may encounter that aren't necessarily motivated to get well? Or are we going to be penalized for that? There'll be ways to do risk adjustment in the new payment arena, but we have to have data and research. Some of the best research is coming out right now. Julie Fritz is a machine, and she's putting out some good data about cost savings on the back end of an episode of low back pain. If we are on the front end and a patient with low back pain sees a physical therapist within the first 14 days of the episode, we save the system $2,000 to $4,000 per episode of care. That is huge. And when you bring data like that to a payer, and then they institute that in their practice and they see the cost savings, they become believers and they begin to put physical therapy on the front. But the other thing we can do is to go direct to industry and direct to consumer, because prevention in the new way of thinking about healthcare is not necessarily care or delivery of care for somebody who already has a disease, but it's about prevention. And I think we have a huge role to play. It might not be within a third-party payer system. It may be cash. I travel a lot in my role, and I was on an airplane between Shreveport and Atlanta, and there was a physical therapist sitting by me, and she was looking over my shoulder, and she just initiated a conversation. Are you a PT? I said, yeah. She said, I am too. I said, where do you practice? Well, I work for Delta. She worked for the airline, and we were both on the plane. I said, that's interesting. She said, well, I used to be in a small private practice in Atlanta, and I I started a medically oriented gym in the Atlanta airport, and I've saved Delta 50% on their work comp claims in the first year. So we can save money if we're on the front end of injury and illness. And so getting out of your comfort zone, it's not your mama's practice anymore. We're going to have to get out of the four walls of a clinic and go and show industry and consumers and the people where they live, work, and play on the golf course, at the trucking industry, how physical therapy can help people move safer and prevent a small ache or pain from going into a full-blown injury or disease process. So those are the ways I get excited about how physical therapy, with the level of access that we have right now that we've never had before, we don't have to sit around and wait for a referral anymore. We go get that part of the population that's never seen a physical therapist before and show them what we can do for them.
Yep. So students, all of those outcome measures that you're learning in class right now, they are not useless. They are very important, and you will be using them every day for the rest of your life. So keep up on those. They're not always the most interesting part to learn, but they are going to keep you getting paid and proving your. So we've got coming in. Go ahead and access more.
Yep.
Can you hear me still?
Yeah, and compete with yourself on these outcome measures. You may be in an environment where no one else is using them, but that doesn't mean you don't have to. And if you have a different diagnostic group that you're learning to provide therapy for, use them as a metric of success for your own clinical growth and development, because one day they'll be very useful. Soon.
Very soon. All right. Do you see Alexis Morgan's tweet?
I do.
Can you hear? She asked, how would you like to see DPT curriculum change in the years to come?
I would like to see us spend a lot more time in clinical decision making and problem solving than we do right now with actual patients in front of us. I think that's hard. It's challenging to schedule. But some of the things that we do that's repetitive in nature with technology the way it is right now, you can get that stuff on your own and then come to class with it. These flipped classrooms are very intriguing to me. You study, you do self-study, and then you come to class and have a facilitated conversation about it. It's one thing that I would like to see more curricula do. I would like to see curriculum change so that we're not teaching parts of the body or neuro and ortho in our little silos, but we're integrating the movement system across that, because I'm an orthopedic specialist, but every one of my patients has a brain, and every one of my patients responds to motor control and motor learning. And so we have to quit saying this is ortho curriculum and this is your ortho semester, and get into integrating our expertise in movement and helping students assimilate that information better across systems. And I think the clinical internship model that we're talking about right now, as far as what makes for the best outcome, there's some evidence that's being generated that an integrated clinical experience, meaning you have clinical experiences throughout your curriculum to begin to apply the things you're learning to a patient scenario, is important. So those are the things that I would like to change. And each school, each program has somewhat of a different way of rolling out their curricula. And standardization has kind of been a taboo word through the years, but I think to be able to do it effectively and to expect a similar outcome and a product out of physical therapy higher education, we're going to need to loosely standardize some of the things we do so that the expectations can be a little more similar across the profession, so people know what their physical therapist should be able to perform with them.
What do you think about adding business courses into the curriculum?
We talked about this yesterday, actually, and I think this is because healthcare, and this may be taboo to some, but healthcare, the healthcare industry is a business, and patient satisfaction is similar to customer satisfaction. So there's a lot of the soft science of people skills and communication skills that I think most programs are delivering right now. And most programs have a course called administration or marketing or something to that effect to make sure the students graduate understanding the importance of compliance with regulatory change and payment. But having some business sense or business savvy about what the expectations are when you graduate, that you have a license. You also have an NPI, which is your National Provider Identification Number, which follows you wherever you bill. So understanding that your license and your identity as a provider, at least in the Medicare system, follows you throughout your career, and that is your practice. And your obligation to your patient is yours alone, not necessarily the company you work for. So understanding that your practice is actually what you own about your future, and your primary obligation is to your patient, it is as much a business as it is an ethical and clinical practice responsibility for physical therapists. So adding business to the curriculum, yes, but you got to figure out how to do it as a transcurricular thread. So you make sure you're talking about it in digestible chunks so it's relevant throughout the curriculum. Usually my students and graduates check out during that course because they'd rather be doing a manual therapy course or something where they're learning techniques. They check in about 2 years later when they realize, dang, I could be making money doing this, and I should have listened to that administration course.
That's awesome. So we're getting a few questions that are kind of similar that are coming in. Matthew St. John and Kayla Kegginson, they're all kind of asking questions along the same line. So we're going to go with Kayla's. It says, how do we maximize advertising and marketing for direct access? And we're just going to go with that as a whole because Matthew's was the same thing. You know, he was asking with direct access, why doesn't the profession advertise and market like our competitors?
We have traditionally not been very good at boasting about what we do, because those people who are drawn to physical therapy tend to be very humble, hardworking, other-centered kind of people. That's why you want to be a physical therapist, because you're concerned about somebody else's quality of life, and you're not so good about patting yourself on the back. So one of the things that probably would help our marketing is to turn our patients loose to the media, to toot our horn for us, because those patients who you make a difference for every day think that you're a hero. We did a branding campaign that was initiated in 2007, and a lot of the pre-campaign research was to look at what patients thought about their physical therapist, and they literally think their physical therapist is a hero because you have a knowledge and an expertise that's distinctive that helped them get back to doing the things that they loved. So the reason we don't have a national advertising campaign is the financial implications for it. We have had public service announcements, and we've had videos that APTA has developed for people to run in their communities, and some people have taken the initiative to pay for that within their communities. But I don't know if you're aware of what a Super Bowl ad campaign costs. It's like $3 million for 30 seconds, and that would consume 10% of our budget. And we're trying to do so many things. Maybe a foundation account for people who want to donate money to a nationally recognized advertising campaign as an idea, or double our membership so that we have the resources to do something like that would be great. But I do understand that you don't see it in the media as much. We have a great spokesperson in Stefania Bell, who is on ESPN this time each year. I think she's one of our greatest PR persons to let the public know what physical therapists' unique body of knowledge is. And I think we need more physical therapists to be talking to the public about the great things that we do for our patients.
So,
and if you don't know Stefania Bell, she's going to be at the conclave. Are you going to do that plug, Brooke?
I was going to say, I'm going to get another plug out of this. So it all goes back to membership. And then the other, it's in the hands of Stefania Bell, who we're going to hear from at National Student Conclave for all of the students who are listening, who are attending. So we're really looking forward to that too. So we're getting a few questions that are all coming in with the same theme. It's interprofessionalism. So Amy Winston asked, how do you envision APTA collaborating with other healthcare associations? And Scott McAfee asked, what have you learned about our profession after building so many relationships across different healthcare disciplines? So maybe take the two of those.
Okay, I'll take the first one about interprofessional collaboration. I think this is one of the most important things that your generation will do, because you're already in networks across disciplines. I think a natural partnership for physical therapists are nurse practitioners who serve rural communities that are underserved. A perfect combination in a rural community, I think, would be a nurse practitioner or a PA, a mental health specialist, and a physical therapist. So if you're sick, then the nurse practitioner, PA, or the family practice doctor can manage your sickness. If you're hurt or you're not moving, the physical therapist can manage your movement dysfunction, and the mental health specialist can deal with the things that are specific to their discipline. But together, I think that kind of trio could manage just about anything in a specific population, particularly those that are underserved, and triage and make sure that the people in that community get to specialized care when they need it. So I think there are opportunities for us to work with primary care practitioners to demonstrate to them what we know and serve on teams with them. Our orthopedic residency at LSU has a lot of interaction with the orthopedic surgery department at LSU. And we put our PT residents in a clinic with the orthopedic surgery residents, and they learn from each other. The attending many times will have our PT resident teach their interns how to do a quality physical exam. And that helps orthopedic surgery residents learn what physical therapists actually know and do. And it's created a great collaborative spirit, and ultimately you step back, you create that environment in an academic setting, and you step back and watch the magic happen. And pretty soon it's not about what you do or what I do, it's about what that patient needs. And oh, you're good at this, and I'll go get that while we're making sure the patient's needs are met for today. And your generation will be more about what that patient's needs are, I think, than what our professional needs are. And ultimately, when the patient wins like that, we'll all win.
Yeah, and the Student Assembly has actually made some really good headway with connecting with other professional associations. So we're really looking forward to seeing what's kind of going to come out of that. And who knows, in a few years, you may walk into a room and get that one-stop shop. Who knows? The options are really endless with that.
That would be phenomenal. And I've enjoyed watching that environment in our residency programs. And the older ones of us interfere with it, the better it is. It's really a cool thing to watch when ultimately the patient's needs are the one are what trumps everything in the room.
Yep. So we're gonna go with a lighter question. So let's take a breath for a second. We've been digging deep for going almost right at an hour now. So
Wow.
two questions. So I'm a big reader. So I always like to ask people what is their favorite book.
I
So what's your
have
favorite book and why?
a favorite book. I can't point to one favorite book. I love Team of Rivals by Doris Kearns because it's a story of Abraham Lincoln and his cabinet. He chose his political rivals to serve with him so that they would have great debate and come up with, I mean, look what they did. They did the impossible when Abraham Lincoln was president. But I also like to read leadership books, anything John Maxwell that I can get my hands on. Patrick Lencioni on teams and authenticity. He's got a book called Getting Naked, and it's nothing about getting naked. It's about being authentic with the people you serve with. Um, it's a first year PT school book about getting naked. And then there's one more that I picked up a couple of years ago, and it's written by a guy named Sutton, who's a Stanford professor on leadership, and he has this no a-hole rule, no a-hole, and I won't say the word because it's a dirty word, but he doesn't hire a-holes in his environment because they bring the morale down. And it's since I've read that book, it impacts my decision making as a leader in an academic institution for sure. Try not to hire any a-holes.
No a-holes in your life. Kick them all out.
No. If you
Get
have
them
a choice between a very nice person and an a-hole, choose the nice person.
every time.
Every time. It's a great rule to live by.
That's awesome. So we're going to take one more question before we close up tonight. So let's go ahead and take Kayla's question. Kayla asks, what is the future for PTs in the ER?
I think we do a lot on injury triage, and there are already PTs serving in ERs across the country. You could be in a consult situation in an acute care setting or in your community and carry a pager or make sure that they had your contact information, because there's a lot of acute injuries that we can manage and co-manage with the ER physicians or whomever they refer the patient to. I've got some graduates who just started a small practice here in Shreveport, and they're very excited. And they went to talk to several of these the 24-hour physician opportunity that you don't have to have an appointment to get into. They're popping up all over the place, and so they marketed to those clinics and were very well received because they need physical therapists so that they can refer their patients to. So it's a great opportunity for physical therapists to collaborate with other healthcare professionals in an emergency setting, nurses, physicians, and family practice.
Yep. Well, I think we're going to get cut off from YouTube if we don't go ahead and cut out. So we want to be able to save it. But thank you so much. One, to all of the students who came out and asked questions. We've had quite a few viewers. I've been able to see it at the bottom of our screen here. And President Dunn, we appreciate you taking an hour out of your very, very, very busy schedule to chat with us. And we're looking to, continuing this conversation with you online and at the town hall at NSC. Last shameless plug.
Thank you, Brooke. I enjoyed it.
Problem.
I look forward to seeing you in a month.
Awesome. We'll see you then. Good night, everyone. Thank you.